Musculoskeletal framework are meant to guide FCPs in their practices. This video is a short review of the framework so that it would help for those who are preparing to work as a FCP in their near future. Musculoskeletal conditions are the single leading cause of disabilities in UK and most of them are avoidable. To address this, Health Education of England and NHS England created a musculoskeletal core capabilities framework to support and improve the MSK services, especially as a first line, first contact physiotherapist. The musculoskeletal core capabilities framework are divided into 4 domains, which includes 14 capabilities. The 4 domains are Domain A, person centered approaches, Domain B, assessment, investigation, and diagnosis, Domain C, condition management, interventions, and prevention, Domain D, service and professional development. Capability 1, communication. By communication, it means not only communicating with the patients but also with the multidisciplinary team. For example, electronic communications, communicating the reports, like that. Capability 2, person centered care. Anything that does is to get the appropriate care for the patient. This may include shared decision making. Capability 3, history taking. This includes taking history of previous medical conditions and ongoing treatment. Capability 4, physical assessment. This includes the formal objective assessment. Capacity 5, investigations and diagnosis. This includes special tests in physiotherapy and radiological investigations like X-ray if it is necessary, and making a clinical diagnosis from the investigations that we have made. Capability 6, prevention and lifestyle interventions. This includes patient education regarding preventive measures and lifestyle adaptations or modifications, whichever is necessary. Capability 7, self management and behavior change. This includes advices for self management like self stretching and some sort of ergonomic advices. Capability 8, pharmacotherapy. This includes the awareness of common MSK meditations, for example, analgesics. Capability 9, injection therapy. This includes taking intra-articular injections. Capability 10, surgical interventions. Awareness about common MSK surgical interventions so that we can explain to the patient about the surgical procedure and relieve their fear about the surgery. Capability 11, rehabilitative interventions. Here comes the role of physiotherapy. We are well known about the early rehabilitation procedures and that can be started immediately. Capability 12, interventions and care planning. This includes exercise prescription so that the service user can do it at their convenience places. Capability 13, referrals and collaborative working. This includes referring to the other multidisciplinary teams, for example, a podiatrist. Capability 14, evidence based practice and service development, which is necessary for any profession, especially health related. Scope of the framework. The framework applies to all healthcare professionals who serve as a first line or first point or contact for adults with undiagnosed musculoskeletal conditions. Practitioners should be able to assess, diagnose, and develop a management plan and offer initial treatment advice and make onward referral if necessary. Now, what's outside the scope of this framework? Managing musculoskeletal conditions that require high level capabilities, like a biomechanical problem with the foot, which requires a podiatrist, and likewise, which requires additional capabilities, are outside the scope of this framework. Managing multiple long term conditions and multiple healthcare needs are outside the scope of this framework. Additionally, managing pediatric MSK presentations and to deliver treatment interventions for previously diagnosed conditions are also out of the scope of this framework. This framework does not dictate how practitioners should demonstrate their capabilities, but just give it guidelines what they should possess. So we should find additional resources to improve the services and ensure patients receives the care they need. MSK frameworks are meant to guide FCPs in their practice. This video is a short review of the framework so that it would help for those who are preparing to work as a FCP in their near future. Detailed video about each the capabilities would be following shortly. So thank you for watching this video. See you soon.